as we kick off this wonderful conversation. Welcome all. This is a wonderful day. My name is Maximina Jokonya. I'm a voice fan coordinator under Y Plus Global, and I'm your moderator for today. So for us, really want to have a rich discussion as well as, collaborating and networking at the end of the day this day. This webinar is to launch the implementation brief on improving the quality of pre-exposure prophylaxis implementation for adolescent girls and young women in Eastern and Southern Africa. We are really excited to have you all here and share with you the critical content of the brief, which is based on the think tank that we had sometime in March, where we really pulled everyone from stakeholders, from HYW themselves, from implementers, donors, to really have a discussion in terms of PrEP in East and Southern Africa for adolescent girls and young women. So we'll move on to our housekeeping rules. Every house has got a rules that you need to follow. So really, what we want to really let you know is that if you are facing any technical issues, please send us a message via chat. We'll be able to respond to you as much as possible. If you have any general comments, really, please also send them through the chat box, selecting all the panelists and attendees. Questions. We really welcome them. We want to interact with you. So please send through your questions in the Q&A box, where we really want to understand and also address each and every question that we have from you. We also want to let you know that some of the questions will be really responded as we are going through the webinar with certain speakers and also panelists in our platform, as well as we have a Q&A session at the end of our webinar. Really, those also another opportunity for us to then interact with you as well. Just to let you know that today we are really recording this webinar and would really want to share it with you once the webinar is done. And also just encouraging everyone that this will be very much available on our children's and also AIDS organization as well. You can also subscribe to their platform where it's saying Learning Collaborative. Please subscribe to that platform, and you even find more resources at that platforms as well. So welcome. It's really exciting. So today we've got a range of speakers who will be sharing the key messages from the brief. We'll start to, our welcome from UNICEF and co-organizers of our think tank. And we'll also have our HYW, those that also implemented, PrEP in their respective countries as well, especially in East and Southern Africa as well. But also to just mention that we also have Lori, who's also the regional advisor for WHO. We've got also Hughes Lagos from WHO Afro. We've got Cynthia Masque, the head of Africa and Middle East at the Global Fund. So it's really, really, really excited. And also we are going to get into a discussion more with our representative and think tank participants to share with us, key implementation consideration for PrEP programming, in Eastern and Southern Africa for adolescent girls and young women. Then we have a Q&A session where we really love to really engage with everyone, whereby we ask questions. Then we'll also really get to enjoy some of those insights and also contributions that we have for the implementation to be successful for adolescent girls and young women. So I would really love to let you know that we are moving on into our welcome remarks. We also have Hughes, we have Cynthia, and we have Lori as our welcome remarks. And just to give a brief welcome and background, as we know that adolescent girls and young women are aged between the ages of 15 to 24 really account for the 68% of young people in East and Southern Africa who are living with HIV. We know from the recent reports, especially from the UNAIDS one, that adolescent girls and young women are as likely as their male peers to really acquire HIV infection. And in 2020 alone, they accounted for 26% of new infections in the region. We also know that, as HYW, our risk of HIV infection really is multifaceted. We've got different range of, inequalities. We also have intersectionalities. If we are talking about biological, behavioral, social, and also structural factors really that affect us really, and that really drives the risk of HIV infection. We know that we as HYW experience sexual as well as gender-based violence, especially now when we're talking about COVID-19, which really further exacerbated our risk of really encountering sexual as well as gender-based violence. We are at disadvantages because of lack of or limited availability and access of quality as well as appropriate sexual reproductive health, and also HIV prevention services. We are constantly subjective to harmful discriminatory gender norms, and we are really regularly excluded from the economical and also educational opportunities and activities because of our gender, because of our age. Really meaningful engagement has not been there for us as adolescent girls and young women. We need access to choice of quality in terms of prevention intervention. We need this because they will help us to stay negative. And we know that our lifestyles, our choice, our autonomy, we are able to really have that and be able to adapt for our lives, and we're able to grow into these dreams that we have and have opportunity as individual adolescents in our diversity really. So what do we know? We know that oral PrEP is one of these options really. It is now have been proven, a highly to be a highly effective strategy in preventing HIV infection. We know that evidence really now suggests that a similar protective benefit of PrEP for young people at risk of HIV. We know that we have that protective. And really, when I'm talking about PrEP, when it's prescribed and also taken, and also, the adherence takes place, we know that the risk of HIV infection may be really reduced by 70% or even higher, making PrEP an important HIV prevention intervention, actually choice for adolescent girls and young women. So we want to then dive into the discussions of today to really explore that choice, that opportunity that we have. So I'll hand over to the other colleagues that are also going to do the welcome remarks. I'll hand over to Hughes. Over to you.
Okay, thank you, Maximina. Good afternoon, participants. I would like, on behalf of WHO, to thank you for inviting us to make this opening remarks. We think, as WHO, that our meeting is really timely because it brings an answer to a question that we have while we were looking at data concerning the progress in the region about the HIV. We were asking ourselves, how could we further reduce new infections in the region? So this meeting, with the willingness to increase the uptake of pre-exposure prophylaxis, respond to that concern, especially when adolescent girls and young women are targeted. As Maximina just said, in Eastern and Southern Africa, 26% of new HIV infection is attributed to this subgroup. So this is fully in line with WHO guidance, which is clear to offer PrEP to those at substantial risk of HIV in a stigma and discrimination-free way and as part of combination prevention. Since WHO launched the guidelines on PrEP in 2015 and the implementation tool in 2019, PrEP use has been increasing. There is growing experience from implementation both demonstration project and country implementation for adolescent girls and young women, including recently the demedicalized, simplified, and differentiated PrEP service delivery accelerated by the COVID-19 pandemic. However, there are some challenges when implementing PrEP for adolescent girls and young women. For instance, supporting the focus on women who will benefit the most. Retention, meaning supporting women to continue PrEP. Delivering other services together with PrEP, such as contraception, testing and treatment for sexually transmitted infections, and cervical cancer. We also have as challenges, Maximina also raised it, intimate partner violence, stigma and discrimination, and youth-friendly services to increase the choices. Most of the time, as the health providers in the public sector stigmatize, we think that it's better to go and offer services out of the Ministry of Health facilities, but we think that in addition to doing that, we need to promote to ensure that services that are provided in the government facilities are youth-friendly and adolescent-friendly also. So we think ultimately that it is important to learn from the varied experience across the region, and this webinar offers this opportunity. So as WHO, we are expecting important insight from this session today to help us offer PrEP to more adolescent girls and young women in an acceptable and effective way, with benefits to them and benefits to public health. WHO remains committed to learning from the latest evidence and supporting its translation into implementation. Thank you very much, Maximina.
Thank you so much, Hughes. Over to you, Cynthia.
Hi, good afternoon, everyone. Well, good afternoon from Geneva. So I'm not going to make any arguments about the reason why PrEP is an important tool, because that has already been asserted. Just to underline from that thought that it's therefore great to be part of this partnership that's concerned about the rollout and the scale up and the sustainability of PrEP-based interventions. Then the second point that I want to underscore is that the rollout learning that we've garnered from working with oral PrEP, which I guess is the basis for this webinar, is important because it helps us to address the delivery challenges to scaling up that we've experienced, even as we prepare to take advantage of the new tools for PrEP that are coming online or that we already have online. I think those will even be more challenging. So we really do need to make sure that what we have learned, we are consolidating and we are preparing to expand. The next 4 points that I want to list, because there is a time constraint, come from this reflection. The reflection is that the Global Fund investments for PrEP in our current implementation cycle increased from 7 million to 27 million. Proportionally, that's a large increase. However, here are my 4 points. Number one, while this is a great increase in investments, you realize that there isn't enough money for the kinds of gaps and challenges that we are facing in the rollout of PrEP. Therefore, partnership and effective partnership is key. So it's all hands on deck. The second point, I think, in reflecting on that statement about investments is that we need to figure out how to use these limited investments effectively, hence the webinar. And so I do hope that this will be a tool for us to go and effectively use the resources that we have. The third reflection from that investment statement is that the monies that I just mentioned are investments beyond the East and Southern Africa region. Therefore, the work that we're doing here is going to support and propel work in other regions. It's providing learning and providing guidance beyond the region itself. And the last point that I want to make is that even though I was talking about an increase in the amount of money for products for PrEP, we have other investments for behavior influencing activities, and more investments for activities to address structural barriers. So my hope is that this webinar and the tools that it provides us gives us an ability to put all these types of investments together to ensure that PrEP is rightfully used and sustainably so. Let me conclude by just saying that the Global Fund recently reaffirmed its commitment to work with adolescent girls and young women in its new strategy that will last from 2023 to 2028. This is good news because then at least we have the continuity we need in order to generate sustainable gains for HIV incidence reduction. So I think it really is a great investment to be part of this webinar to ensure that this launch of this brief can be rolled out even beyond this region, like I said. So together we can make a difference in the lives of adolescent girls and young women and help end HIV. So I do hope that by the end of the session, we'll be more energized and clearer in terms of what we need to do next and immediately after the session. Thanks.
Thank
Hi,
you,
Maxie.
Cynthia. Learn, consolidate, scale, invest, and partner. Over to you, Laurel.
Very nice. Thanks, Maxie. I hope I can match your energy. We at UNICEF in Eastern and Southern Africa are delighted to join our co-organizers and partners to launch this important brief. The brief brings together knowledge and builds on and complements the guidance from WHO with really practical considerations about how to move the quality and coverage of PrEP programs for adolescent girls and young women. The brief outlines the lessons learned from implementation to date, as well as the evidence, and provides key considerations that were generated during the think tank meeting held earlier this year. And that is something I'm also really excited about. Over a 3-week period, 30 thought leaders and stakeholders, including young women, researchers, advocates, implementing partners, government representatives, UN sister agencies, and donors joined online sessions to share and consolidate evidence and learning. UNICEF was proud to lead this work and really appreciates the contributions of our partners and funders. This work was made possible thanks to support from the Global Fund and from the government of Sweden through the Together for SRHR program. Heartfelt and special thanks to all of the think tank participants. The brief would not have been possible without your active engagement and crucial contributions. Thanks so much and welcome. Over to you, Maxie.
Thank you so much, Lori. We really, really appreciate all those insights, and also, our gratitude really goes to the whole think tank really for convening for such a conversation. We will now hear from our think tank members that really participated as they share the key consolidation from the implementation brief. We're going to start off with Tabeleng, who is a Voice Fund ambassador based in Lesotho. She's going to share with us and help us understand how engagement and participation of adolescent girls and young men and the community at large is very key and important to achieve successful PrEP programming in East and Southern Africa. Then after that, we'll also hear from Tafadzwa Chakare, who's the technical director at JPECO in Lesotho as well. He will talk to the critical service delivery aspects. It's always good to have that aspect of where is HYW going to get those PrEP products at the end of the day. So he will speak about service delivery and also ensure the quality of PrEP service delivery for adolescent girls and young women. We'll move to Mopo Radebe, from WHO Afro, who will share with us and explain how PrEP best fits within the combination package itself. We are talking about the issue of choice here, and combination package is very important to promoting choice and how determining who benefits most from PrEP can be done, to ensure programmatic success. We hear from Hasna from the National Department of Health in South Africa, who will cover the importance consideration for adolescent girls and young women who are pregnant and breastfeeding. We are talking about meaningful engagement, not leaving anyone behind. So we are talking about adolescent girls and young women in all their diversity, really. And finally, we hear from Dr. Lillian, who will speak and talk to us about new PrEP modalities and making them work for adolescent girls and young women. Just a reminder, we will always have questions. We want to interact with you. Please post your questions in the Q&A box as we get them either during the course of the webinar or in the Q&A session. Over to the slides that you're going to be interacting with.
So regarding PrEP as one of the most effective HIV prevention options, as much as it is very effective, especially when used correctly and consistently, there are some barriers that have been recognized as limiting adolescent girls and young women from accessing PrEP, which some of them are the rumors about PrEP effectiveness, myths and misconceptions around PrEP, the fear of the burden of daily pill taking, availability and accessibility, as well as perceived or experienced side effects around PrEP, which calls for a collaboration in terms of demand creation strategies that needs everyone who is affected from the communities, stakeholders, relevant ministries to ensure that the demand creation strategies we come up with are the ones that are going to encourage and maximize service uptake for reduced new HIV infections among adolescent girls and young women, which I would firstly like to talk about the one area that talks about PrEP as a positive choice and a healthy decision making for adolescent girls and young women. These girls have to understand that this is part of their fundamental rights, part of sexual reproductive health rights to have PrEP as a choice, not that they are accessing PrEP because they have been involved in risky behaviors, because it is already stigmatizing and is one factor that is prohibiting them to freely access PrEP in health facilities. The other strategy that can be used for demand creation is effective messages that respond to adolescent girls and young women preferences and circumstances, which literally talks about context and messages that talk about PrEP as a healthy choice, PrEP as an option for a healthy living, PrEP as in a way that is amusing, in a way that is accessible for adolescent girls and young women. If it is time to deal away with old-fashioned maybe leaflets, flyers, and opt for social media platforms to effectively disseminate our messages on PrEP, let's do it for maximized service uptake by the target population. The other strategy that we need to use is to disseminate information and make a noise on awareness or greater need to integrate PrEP and other HIV prevention services together, not for a person to know that I'm going to access PrEP on Thursday, whereas I had access to other HIV prevention commodities on Monday or other things. It's already tiresome to go to a health facility. So if these services are not integrated so that it's a package that you access once you went to a hospital or a health facility and then you go back home, they're not going to be easily accessible for adolescent girls and young women. The last one is multiple trusted sources that are important to reinforce key messages and support access to reliable information and services for adolescent girls and young women, where we are going to capitalize on people we trust, on sources that we know that they're influential and can they have a weight that can instill in adolescent girls and young women that if this person said this thing, it means honestly the messages on PrEP are true. If my mother said something on PrEP, it means PrEP is real. If my community leader can say something on PrEP, if my pastor, if the prime minister, if I can get this on social media in this website, or maybe it is endorsed by Ministry of Health, or maybe it is endorsed by Ministry of Gender, I know this really works. So we need to have relevant structures informed on PrEP so that they can be able to emphasize on the importance of it for greater access. Thank you so much. For maximized PrEP service uptake, we have to ensure that adolescent girls and young women as key beneficiaries are part of the teams that are doing programs on PrEP for buy-in and support. This means that they have to be empowered with information so that they are able to make positive decisions about their own lives and health. This will help in ensuring that they are meaningfully engaged in decision-making platforms that are going to inform the design, implementation, and monitoring and evaluation of PrEP programs. If they are working, if there's a need for a change, or there's a need for new innovations. This also calls for this adolescent girls and young women to be well trained, to be integrated into existing health and community systems, and are well equipped with supportive supervision and monitoring tools so that they're able to measure progress and they're able to lead conversations with their peers in the community. Lastly, community engagement is one of the main aspects we can't overlook when we talk of maximized service uptake, support, and buy-in of our interventions in the communities. And this can be done using what is called socio-ecological model framework that emphasizes the relationship between the development of a person and the environment in which they live, in terms of what a person becomes, what a person is, the choices they make are all influenced by the environment and the kind of people surrounding these people, which is very vital for us to bring on board community members or structures that can deal away with the social norms that we grew up knowing for buy-in and support of PrEP. It calls for parents' engagement. It calls for community leaders such as teachers, area chiefs, doctors, faith-based leaders, calls for male partners, and all those people around us to be on board, be informed on the importance of PrEP so that they are able to know the truths and deal away with myths and misconceptions around this that are most of the times brought by our cultures and our misinformations and all that. So if we bring them on board, this can help us that we maximize service uptake for PrEP and better future for adolescent girls and young women.
Regardless of where they are located, PrEP services need to be patient-centered. Effective service delivery platforms for PrEP are accessible, appropriate, and acceptable to adolescent girls and young women. Adolescent-friendly facility-based approaches such as one-stop shop and fast-track lines as per WHO guidelines enhance accessibility and acceptability of PrEP. Discrete and well-designed packets containing PrEP commodities are needed to support acceptability and confidentiality for adolescent girls and young women who are using the intervention. Quite often, young people are prefer not to come to health facilities. So providing PrEP should not be confined to just healthcare facilities. Multiple service delivery platforms located within the community and non-conventional locations can be used to maximize access to PrEP by adolescent girls and young women. Demedicalization of PrEP delivery beyond facility platforms is necessary to promote maximum uptake and sustained use amongst AGYW. This means that platforms beyond the facility are an important opportunity to improve acceptability, but whilst at it, it is important to ensure safety by continuous collaboration with clinical partners. Adolescent girls and young women experience multiple sexual and reproductive health issues, making integrated and comprehensive HIV and sexual reproductive health services vital. Strategies that combine information, referrals, and linkages to services for contraception and sexual and reproductive health are required to address the full breadth of SRH needs for adolescent girls and young women who are at risk of HIV infection. The integration of PrEP into contraceptive services as well as other sexual and reproductive health services promotes accessibility and acceptability amongst adolescent girls and young women. True integration requires clear and consistent policy frameworks for the integration of PrEP into other services. Integration also requires co-creating PrEP guidance and implementation tools collaboratively with contraceptive and other relevant departments that provide sexual and reproductive health services. In addition, true integration demands strong linkages and referral systems between services when these cannot be provided under one roof. When providing PrEP to adolescent girls and young women, there is the opportunity to inform the client about available contraceptive services as well as sexual and reproductive health services and vice versa. Provider competency in implementing adolescent and youth-friendly services is vital. A recent study found that PrEP providers generally accepted oral PrEP as an HIV prevention for adolescent girls and young women. However, the negative attitudes about adolescent girls who are not married being sexually active and concerns about behavioral disinhibition. Some people believe that once people go on PrEP, they start to engage in risky sexual behavior, as well as assumptions that adolescent girls and young women would be poorly adherent to PrEP were common. And based on WHO guidance, healthcare workers providing PrEP to AGYW must demonstrate the technical competence required to deliver effective health services to adolescent girls and young women. And these include respect, as well as protecting and fulfilling the AGY's rights to information, privacy, confidentiality, non-discrimination, and non-judgmental attitudes. And beyond training the usual health workers, and this has been the trend to date, that specific groups of health workers are trained whilst others are left out. Competency really means going beyond just the usual groups such as doctors and nurses, but also training other healthcare workers, including community-based cadres. And these are vital to make sure that health services are provided at the right quality. And so we're talking about also training community-based cadres and others on PrEP to ensure that competency is achieved across the board. And beyond trainings, we also need to make sure that there are opportunities that are provided for continuous learning by all these groups, different groups of cadres.
Hi everyone, my name is Mubu Khatebe and I'm with the World Health Organization. I will talk to you briefly about determining who will benefit from PrEP and the combination package approach. We have to remember that adolescent girls and young women are not a homogeneous group and that their individual health needs or preferences are based on a range of factors. Thus, their risk of HIV infection fluctuates accordingly. PrEP should be made available for all adolescent girls and young women who want and request it. And when they request PrEP, we can conclude that they have identified their own risk and should be offered PrEP. WHO also supports this view. Where assessment processes are in place to identify adolescent girls and young women who may benefit from PrEP, these assessments should be made available across multiple platforms to cater for adolescent girls and young women's preferences and should focus on health and well-being and not on negative risk identification. And if used, these risk assessment tools should be used to support adolescent girls and young women to enter PrEP programs and not to exclude them from PrEP services, especially if they're presenting at facilities having self-identified as being at risk and are actually motivated to take PrEP. And where PrEP is not directly provided, assessment tools can also support appropriate linkage and referral. The use of standardized guidance and tools is recommended as this supports providers in minimizing bias and also increases the accuracy of PrEP assessment processes for adolescent girls and young women. No single intervention will avert new HIV infections in adolescent girls and young women. There is no silver bullet. WHO therefore recommends combination HIV prevention packages which incorporate behavioral, biomedical, and structural interventions to address the multiple challenges adolescent girls and young women face and reduce their risk and vulnerability to HIV infection. Therefore, it is vital that the core HIV prevention package for adolescent girls and young women include PrEP, as this will ensure its availability when needed, and also for PrEP to be included as part of national policy frameworks and guidance to support consistent implementation and scale-up. Social and mental health services are valuable in supporting uptake and sustained use of PrEP for adolescent girls and young women. Thus, linking adolescent girls and young women on PrEP to social behavioral interventions such as economic empowerment, girls' clubs, mentorship programs, etc., can support sustained use of PrEP by adolescent girls and young women. Thank you very much for your attention.
Pregnant and breastfeeding adolescent girls and young women are particularly susceptible to an HIV infection, and it is therefore important that antenatal care and postnatal care services become effective entry points for offering PrEP to adolescent girls and young women. During this time, strict clinical monitoring is the highest priority for pregnant and breastfeeding adolescent girls and young women using PrEP. Effective decision making to take PrEP requires that one understands the specific circumstances of the individual, that it is undertaken collaboratively between the clinical service provider and the adolescent girl and young woman, allows for understanding of the related risks, and it also provides tailored and appropriate adherence and psychosocial support to the young woman. Rapid linkage to antenatal care services and support is required for those adolescent girls and young women who are already on PrEP and become pregnant. And lastly, pharmacovigilance for PrEP use during pregnancy and breastfeeding mothers is absolutely vital. And this needs to be closely monitored and managed if there are any adverse events occurring during pregnancy or the outcome of the pregnancy.
Habari everyone, it's very exciting to see that scientific advancements are currently expanding the options for pre-exposure prophylaxis, as we are coming from a space back in the years where we had zero discussions, we had no clue about oral PrEP, to now having it available in our communities. And beyond just that, we, as you may have noticed, of late we have had different discussions around alternative pre-exposure prophylaxis, such as the vaginal ring and long-acting injectable PrEP. All this together work in favor of adolescent girls and young women, but also communities at large, as we are increasing HIV prevention options. This does not only provide adolescent girls and young women with hope, but also a range of choices to pick from according to their needs and, their background and different seasons they are at in life when it comes to HIV prevention. So when developing and introducing new PrEP modalities, it's very essential for partners, communities, stakeholders, but also policymakers to understand values and preferences of adolescent girls and young women. It's very easy to fall into the trap of believing that all young women are the same, but let's be honest, they are not. AGYW is just an umbrella term that represents diverse groups of adolescent girls and young women coming from different backgrounds, and you may find each setting presents with different needs and priorities. So for us to create, to come up with programs that actually are results oriented, is necessary to put all these diverse preferences and needs at the center of how we deliver these services for adolescent girls and young women, and have them on board as part and parcel of the implementation crew. It's also essential to provide opportunity for reflection and incorporate service level learnings. It will be very absurd for us to conduct demonstrations, maybe to do programs and do not take on any lessons from them to inform how we move forward. It means at some point we might be stuck because we're not open to learning from where we have maybe done right or done wrong in the past. It's also essential for us to ensure that we conduct demonstration projects to assess young women's acceptability to these new modalities, but also use the information collected to inform scale up and support resource prioritization. But I must say something here. It's very necessary for us to be mindful of time when it comes to pilots and demonstration projects, because HIV infections do not wait. So sometimes it helps to borrow lessons from nearby countries and use them to scale up immediately in our settings as we are learning in the process. And last but not least, it's very essential to update service providers on the new PrEP modalities available to provide accurate range of choices, but also information for adolescent girls and young women, as these are the people that young women are receiving information and services from. Asanteni sana.
Wow, brilliant. Thank you so much to our think tankers. We have really shared with us their insights in terms of programming of PrEP for AGYW in Eastern Southern Africa. I hope everyone, we have learned and we are ready to really implement as well. So this time I will also welcome Alice Armstrong, who's the Adolescent and HIV Specialist from UNICEF SRO, to support really with the moderations of the Q&A, like I highlighted before. you are really welcome to really post your questions on our Q&A so that we could really interact with you as well. So I'll give time to Alice to then ask the first question to our panelists. Our panelists, you're welcome. Come to our panel. If you can, turn on your video so that we also see you, so that we could also interact with you together with our audiences. Over to you, Alice.
Wonderful. Thank you so much, Maxi, for all your energy and for hosting this session. We really appreciate it. So colleagues, my first question, I'm just going to get right into it. The first one is for Tafadzwa. Tafadzwa, are you online? Is your video on? Let's see your face. We'd like to know, are there any best practices or examples of how AGYW have been supported to continue using PrEP without interruption? From the presentations and the welcome address, it's clear in the evidence that this is a bit of a problem that we are facing. So over to you, Tafadzwa.
Thanks, Alice, and that's a good question. So amongst the various priority populations that are targeted for HIV prevention and PrEP, adolescent girls and young women tend to struggle to continue on PrEP. And this is worrying because of their elevated risk and the type of incidence that we see in that age group. And in working in a couple of countries, we have realized that to improve continuation rates, just picking up a refill after 1 month of use, we've had to adopt different measures to invest a little bit more in things like SMS reminders for 3 days before the anticipated refill date, but sometimes waiting until almost the end of the 30-day period that you supplied the person for might be too late, because some people get home and they show someone the pills and they immediately told that those are ARVs, don't take them, they're for people who are HIV positive. So you really need to engage them even sooner. So we ended up having to also having a phone call in the first 7 days of the PrEP prescription, where instead of an SMS, we really wanted a human interaction. So the provider calls the user, asks if everything is okay, if you started taking the pills, do you feel any side effects, reassure that most side effects will go away in a few days or weeks, and really get some early feedback with this PrEP user. The other things that we've tried in the Lesotho program as JAPEGO, working with the Ministry of Health, is repackaging. So like I said before, stigma is a real thing because the product looks like HIV treatment. So we have put stickers on the bottles with attractive colors to really make this look like a different product, and to reduce the chances of negative feedback from family or neighbors. And we've also realized that some of the girls move around, they go to school somewhere else, and they don't want to move around with a full bottle of pills. Maybe they're going somewhere for a weekend. So we designed a lip balm. Unfortunately, I don't have it, but it looks like lip balm. It's a little thing that takes up to 7 pills. And in there, they don't rattle, they don't make noise. It really looks like something that can be mistaken as part of a makeup kit. And those are some of the innovations that were born from our program, and also from talking to the adolescent girls and young women themselves.
Fantastic. So understanding those preferences, the discrete packaging, which we heard in the presentation, and also that kind of ongoing support, and that, I guess, that interaction and the human contact, even if it's over the phone or SMS. That's great. Thanks to Tafadzwa. Okay, over to you, Maxi, for the next question.
Thank you so much, Tafazo. I love the lip balm. It's very discreet. I enjoy it as an adolescent girl and young women. So really, thank you so much for that. Hasna, I'll come to you. We know that healthcare workers they are really important and really integral to the success of implementing PrEP. We just want to understand to you, how can we support our healthcare workers to be able to integrate PrEP within the ANC?
Thank you. And thanks for that question. I think what's really important, especially in terms of PrEP delivery, not only in antenatal care, but in all healthcare settings, is for the healthcare worker to be comfortable about initiating PrEP and making sure that the healthcare worker attitude, especially with young people, is critical, and making sure that they are welcoming, they make the young person feel comfortable. And what is also quite important is for them to provide accurate information to the young person. And here making sure that they also explain to the young person what is the risks of becoming HIV positive during pregnancy and breastfeeding. And then secondly, looking at what are the risks of taking PrEP during this period, and to actually balance the two, and to look at what benefits there are for that young person to take PrEP during pregnancy and breastfeeding. And so developing the skills of the healthcare worker and making sure that they are confident in offering PrEP to young people is absolutely critical. And without that, I think that, we won't get a very successful intervention implemented in those settings, but also we will not get the same kind of confidence on the part of healthcare workers and the healthcare users. So those are the critical elements. I think the other important aspect is also not just focusing on those new clients that are coming in, but also clients that are, and young people that are already on PrEP. How do we make sure that those people that are already on PrEP continue to take PrEP if they do fall pregnant, and making sure that they are supported during their pregnancy to remain HIV negative using PrEP or any other prevention option? Thank you.
Thank you so much, Hasna. Over to you, Alice.
Yes, so colleagues, we realize with our technology delays that we are already at time. I see many of you are still online. We really appreciate that. If you're able to hang around for another 15 minutes, we've got a few more questions. I also see there are quite a lot in the Q&A box. So I would encourage our panelists, any of our kind of thought leaders, our think tank members, if you're online, our organizing committee, if you feel like you can type to answer some of those questions as well, we would really appreciate it. So, but the next question I have is actually for Lillian, Dr. Lillian from Tanzania. One of the huge advocates for different prevention modalities for young women. Lillian, my question to you is, how can we engage adolescent girls and young women more in the kind of R&D stage of new and emerging prevention options? So over to you, Lillian.
Thank you so much, Alice. I think it all goes back to meaningful involvement of adolescent girls and young women, making sure that we actually have them on board from the brainstorming. For instance, when it comes to research, it's necessary to have them on board from the brainstorming phase to the research point of view, to the research phase, but also dissemination of results from the researchers. And I know from research, that's when we're moving to implementation. Oftentimes programs have been having these young women on board from implementation moving forward. So you find there's a piece of ownership they're missing because they were left out prior to that. So it's really necessary to look into different ways that we can actually make them own these new modalities that we're coming up with, these new solutions that we're coming up with, so that at the end of the day, they are part and parcel of the journey and we don't have to chip them in later on. But also it's really necessary to look at the way that we are communicating these new information, but also, how we're coming up with solutions. It's necessary that they are also part and parcel of the communication strategies, making sure that they're actually informed early on, not until, for instance, maybe when the vaginal ring pre-exposure prophylaxis is being approved, that's when they're told about it. But it would have been much easier if they had known about the ring from way back, so it's easy to introduce. They do not, less chances that they'll be scared of even using the intervention. And of course, understanding that research is not just for scientists. So finding different ways that we can actually break down the information and make it interesting for adolescent girls and young women to engage and be part and parcel of the follow-up plan along the road. Thank you so much, Alice. Over to you.
Amazing, Lillian. Perfect answer. Thank you so much. Over to you, Maxi, for the next question. We'll probably take another 2 questions and head towards wrap up. Thank you, everyone, for being so patient.
Thank you so much, Dr. Lillian. And just building onto what you said, I'll move on to Tabeleng. We are talking about meaningful engagement and participation, right? And the norm that we've been seeing is that it's a once-off thing. How do you have any best examples or practices that you can share with us so that the engagement part just doesn't become something where we engage adolescent girls or young men, then we drop them off, something that is ongoing, sustainable? Do you have any that you can share with us today?
Thank you so much.
I think we're struggling to hear her, Maxi. We're struggling to hear you. Maybe you could just type in
I think I'm going
answer.
to talk more from the experience I've been having with engaging a young women at table. You come and request, and then you lift them. That. Hello?
Hi, Tabeleng. We can't hear you clearly. Are you able to speak now?
Hello?
Yes. Go ahead.
Maybe it's best she just types the answer in the chat and we move to the next question.
Yes, yes.
So I have a question here from Lucy Kluver, really about thinking about the messaging and how we're marketing PrEP, and whether if we sold PrEP as something completely separate to HIV treatment, we might be more successful in implementation. Just thinking about key messages that come across and the importance of positive presentation of PrEP. Lucy, we really agree, and was very evident in the think tank that this was a very strong recommendation and under demand creation. You saw there was around phrasing or I guess having the messaging around PrEP to focus on health, well-being, positive choices, rather than I guess the messaging focusing on the negative aspect of risk or bad behavior or vulnerability. So we totally agree with you with that question and that comment there. Thank you for that one. All right, one other question we have here, and maybe Hasina, you can answer this one. This is from Dr. Rachel Bagley at WHO in Geneva, and she's saying, excellent presentations. Thank you, Rachel. So she would like to know, how are you thinking about providing PEP alongside PrEP? Is this something you have considered in the South Africa context or are already doing? Thanks, Hasina.
Thank you. So it is really important that we don't just focus on PrEP for those who are HIV negative, but especially those that are also exposed to HIV are offered PEP immediately. And it's not just for those that are exposed to sexual assaults, but we do know that especially with young people, they do drop, inhibitions are often low sometimes, and they do get exposed. And so offering both PEP and PrEP is really important, but also the transition from PEP to PrEP is absolutely critical, making sure that if somebody has been exposed and has been put on PrEP to actually look at how do we measure whether this particular person will actually benefit from PrEP in the long run, and making sure that that transition from PEP to PrEP is also addressed in all of our HIV prevention services as well. And I think what's also very critical is making sure that PEP is widely available at the same time we're offering PrEP as well. And this is something that we are encouraging as we're moving along in terms of expanding the PrEP services in our primary healthcare services in South Africa. Thank you.
Thank you so much, Dr. Asina. Sorry to jump in. I see Tabeleng is also raising her hand. Can you just also respond to us in 1 minute as we are trying to wrap up? Tabeleng?
Hello, Maximina. Thank you so much. I'm sorry I got cut, but I was trying to say to ensure that adolescent girls and young women are sustainably on board regarding decision making, especially regarding PrEP. It means that they have to be informed in terms of what is PrEP. They have to be educated so that they're able to follow up even on the programs that have been created on PrEP. They are able to understand the assessment tools used for monitoring and evaluation of the progress and impact of PrEP, and really do that if they are informed, educated on PrEP, so that and they have the right information about.
Great. Thanks, Ntabeleng, for that response. Really, you know, when we now have the great conversation going, the time is the enemy as always. Thank you so much, everyone, to our panelists, really, for contributing, for engaging with us, for sharing insights as well, especially when we are talking about consideration in terms of implementation of PrEP in Eastern and Southern Africa. As Lori said, this would have not been possible without our think tankers, you know, our participants, from young women themselves, from governments, donors. You know, it was really dynamic. We heard from everyone, and this was a rich conversation. Remember, we have our brief that we have online. Please go and follow that on our platforms, whether UNICEF and also other websites as well. Our gratitude also goes to our UNICEF Eastern Southern Africa regional office, Global Fund, that fight, you know, to the fight of AIDS and tuberculosis as well as malaria, and also other partners that we have that are leading the process, that are pushing for adolescent girls and young men to have choice, autonomy at the end of the day in terms of fighting HIV. We are really particularly thankful to Alice. I think she's been amazing. It's very difficult to moderate something with technical issues. So really well done, Alice, for that. And Alexandra, we really thank you for the technical leadership. Mpo, we really appreciate you. And also Saikwa for the technical inputs. We really appreciate Amy from UNICEF as well. Whoo, there are so many that I need to appreciate today. We cannot really forget our really sponsors and our funder through the Together for SRHR programs funded by the government of Sweden and support from the Global Fund as well. Woo, and my vibrant and patient participants and audiences. I think it could have dropped off like an hour, 30 minutes ago, you know, but you stayed with us, we interacted, we engaged. We really appreciate everyone. Thank you so much. Like I highlighted before, please visit our online platforms, subscribe to our learning collaboratives so that you can get more resources, including this brief that has already been on our website as well. We really appreciate you, everyone. Alice, do you have anything else to say before we close?
Nothing from me. Thank you, Maxi. You've been brilliant. Thank you, everybody, for staying online. Read the brief. It's jam-packed with information. Thanks to our panelists as well.
Thank you so much, everyone. Have a lovely rest of the week and clap hands for me as well. Bye, everyone.